Hi everyone, today we're presenting our qualitative critical review. So the article we're reviewing today is called Developing Self-Management in Type 1 Diabetes at Secondary Schools. Who is responsible? The article's purpose was to understand the role of school-based and adolescents diabetes management. The researchers had four primary questions they wanted answers to, which correlated with the adolescents' experience with responsibilities of type 1 diabetes in school and working with the school itself to obtain proper type 1 diabetes management. The research questions were: what do adolescents perceive the tasks involved in diabetes self management, or DSM, at school to be? How do adolescents understand responsibility for DSM to be arranged for school? How do adolescents experience the sharing of their own responsibility for school based DSM? And what impact do adolescents perceive DSM has on school participation? The researchers chose this amount of questions to obtain a well rounded approach with how the adolescents felt with the level of support. The study used propositive sampling with the inclusion criteria of 15 to 16-year-olds from mainstream high school and no associated disabilities. The students were chosen by a diabetic educator from a hospital setting who then initially contacted the parents to provide their consent prior to the adolescents knowing that the students had an opportunity to participate in the study. Once the parents consented, the adolescents were then contacted and asked for their assent. The participants then had semi-structured interviews which lasted about 45 to 75 minutes through Zoom, phone call, or in person, depending on the adolescent's preference. To analyze the data, there were multiple coding rounds completed by two researchers at a time. Continued recruitment of participants was ongoing to ensure there was an appropriate level of data collected to provide a conclusion. The study uncovered the adolescents' experience in schools, how they felt having to handle their diabetes, and what they would prefer as support. Overall, the students felt there should be an interdependent approach between the school and themselves, along with clear communication. The participants also felt there should be a balance in their autonomy when managing type 1 diabetes. So, for the rigor of the study touched upon credibility, dependability, and confirmability. To promote credibility, the semi structured interviews were recorded and analyzed verbatim by experienced qualitative research co authors. The recordings were also de identified to further minimize bias. Given that the researchers had survey data from the participants, data analysis used consistent cross referencing to ensure the researchers were not misconstruing any information. Coding was done in a paired manner with the use of N Vivo to analyze the transcripts, especially when continued recruitment is happening to provide the right amount of data. The team also included independent researchers who coded the initial data and met with the research team to debrief on findings, similarities, and overall observations. Team meetings overall were also made to debrief on themes, possible biases, and overall clarifications of codes. Documenting and journaling the process was extremely important in this research study since the researcher wanted to increase the level of trustworthiness of the results provided. So, for the breakdown of the article, this article had a wide variety of strengths along with some weaknesses. The researcher approached this study through an occupational lens to help enhance management in adolescents handling diabetes in school. To further enhance the strength of the study, a variety of very experienced researchers and co-authors were on the team and used consistent system to obtain the necessary information to further answer the research questions, and ultimately to avoid any lack of credibility. This also included the level of cross-referencing to the initial data and the use of qualitative software. But this study did have some weaknesses, including the limited stakeholders, which only included the students' feedback, which was received throughout the time of the study. This also plays a role in the small sample size, only including specific individuals that were recruited to participate. Lastly, the study mentioned how two researchers who coded the data are parents to teenagers around the same age as the participants. Their teenagers also have type 1 diabetes, which can lead to a level of bias that can weaken the study. But although this research does have its weaknesses, there is valuable information we can use in OT.
In critiquing the study, it was found to be done well, but with some areas of growth. Areas of the study to highlight would be that it did receive approval from the Ethic Committee. The methodology aligned with the research question. It consolidated criteria for reporting qualitative research guidelines. It was consistent in documenting its findings. And last but not least, it was transparent in its findings as well as theme. One of the main areas of concern in this study was that the results cannot be generalized beyond the specific participant group due to sample size and lack of diversity within. as well as the included perspectives being only from the adolescents. This means we miss out on valuable insight from the family members, school staff, and healthcare professionals. There's also very little data on those who declined to participate, which could have helped us better understand the full context of recruitment. With this data, we can understand who declined to participate, why they declined to participate, and their backgrounds. To address these issues, future studies should consider a larger and more diverse sample, as well as actively involving multiple stakeholder perspectives. Gathering input from parents, educators, and healthcare providers would offer a more comprehensive view of diabetes self management in school settings. Moving on to clinical implications, this study highlights the need for family centered interventions that support adolescents in building health management routines. By framing diabetes self management as a shared responsibility, occupational therapists can promote better school participation and quality of life for students with type 1 diabetes. For evidence based practice, the study supports future integration of occupational therapists into schools, not just to work with students, but also to educate teachers on how to recognize and support medical needs in the classroom. This promotes interprofessional collaboration between families, educators, and healthcare providers. Looking at the biopsychosocial model and how it relates to the adolescents managing type 1 diabetes, we can see that when it comes to the biological factors, adolescents are dealing with hypoglycemia, management of insulin therapy, and frequent fatigue. These are big stressors that can affect their daily function, especially in school where energy and focus are critical. Moving on to the psychological factors, many adolescents with type 1 diabetes may experience depression, anxiety, and even fear that can be tied to their diagnosis and routines. From the constant monitoring of their blood sugar levels, pressures of being different than their peers, or even just fear of falling ill can be mentally taxing. Lastly, there is sociological factors. Poorly managed type 1 diabetes can result in decreased school attendance, less participation in sports, extracurricular activities, and even isolation from peers and staff. This can impact both an adolescent's academic performance and overall development in these earlier stages of life.